Whether you suffer from chronic back pain, have a sports injury, or just need a realignment, having an appointment with this person will give you relief in no time. Let's meet a chiropractor. Hi, Amanda.
Hi.
Thank you so much for inviting me in your clinic.
Yeah, welcome in. Let's get to work.
Sounds good.
I am Amanda Zelischuk. I'm a chiropractor and I work in Vancouver. So the most common thing that people know chiropractors for is the chiropractic adjustments. You might hear like a crack or pop noise when you release pressure or gas from the joint. We also work through the muscles, so soft tissue therapy, going over exercises and stretches and kind of home care stuff as well. I started off in athletic and exercise therapy, so I was really into health and fitness and working out and exercise. I worked with sports teams, so kind of sideline, doing the taping, prevention and treating of injuries. But the sports side wasn't really for me. I prefer more clinical settings. That kind of led me into this path. Most people start off with an undergrad. You only need 3 years of undergrad. Most people get their degree, and then after that, it's a 4-year degree program at a chiropractic college. I went right from my undergrad into chiropractic school and started looking for a job while I didn't even graduate yet, and I was already on it, so I was kind of eager.
All right, Amanda, I'm excited about this. Can you walk me through one of the exercises?
Yeah, so I'm going to show you a cable row. What I'll get you to do is step forward with your left leg, bring your right leg back, bend through your knees so you're in a little bit of a lunge. You're going to reach forward with your right arm, and then the motion is pulling your elbow back towards yourself. And then this time we'll do it with the weight, so I'll get you to grab onto.
Okay.
So starting with the arm straight ahead, and then you're going to pull back, squeeze through the shoulder blade. That looked perfect. Nice. And then we can do a couple of reps just like that.
Ooh, I'm gonna break a sweat.
Yeah, definitely.
Ooh, I already feel my body shake a little bit.
Okay, perfect. You're working hard. So we'll try and do 10 reps.
Okay, sounds good. Can you tell me the type of patient that would usually require an exercise like this?
Yeah, so anybody who's working at a desk, we're kind of guilty of getting into that rounded forward posture, kind of hunched forward. So it's important to kind of open up through the shoulder blades and the chest and strengthen through the muscles of the back.
Oh, okay. Well, thanks, Amanda. That was quite the exercise.
Of course, no worries. With new patients, there's an assessment, so we'll go through a history process. I'll ask them about what they're feeling. Then we'll move on to a physical exam, so I'll get them moving around, and then we can go through a treatment with them as well. The assessment is determining whether they need x-ray or a medical doctor to look at them. If they don't need that, sometimes they need a massage as well, or physio. We kind of decide what they need in their treatment plan. If it's just chiropractic, then it's deciding what are they lacking. Are they lacking mobility? Are they lacking strength? Are they not getting up from their desk enough times in the day? The best part of my job is seeing people improve, so quality of life and function, and seeing them out of pain. People are usually happier when they're not in pain, so it's really nice.
Amanda, thank you so much for having me in your clinic. It was really fun.
Thanks for coming in.
Once again, I'm Miriam for Career Trek, reminding you that this career could be yours.